The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Welcome to our weekly update webinar. This is Rebecca with the WFIA, and I just wanted to remind everyone that we're going to start out with everyone muted, but at the end of this call, there's going to be a chance for question and answers, and I'm going to go ahead and unmute everyone on my end. So make sure that your call or computer is muted on your end so we don't get a lot of background noise. And if you're on your computer and you have questions, you can type them into the question pane, or you can use the little hand raise button to let me know that you want to have your question answered at the end of the call, so that we can make sure we get to everyone. And with that, I'm going to hand it over to Jan.
Good afternoon, and thank you for joining us. This is Jan G., President and CEO of the Washington Food Industry Association, and I'm just going to highlight our agenda today. We're going to start off with a guest from FEMA and discussing PPEs. We've had a lot of questions from you all. We'll be discussing the most recent governor's proclamation on high-risk employees. We'll be talking about new developments in the area of SNAP and online retailers. We'll go into some more member questions and respond to those. We'll be giving some clarity and answering some questions on the SBA loan package, and also be talking about what we're doing with our congressional delegation on some expansion there. And then we'll bring Kat on to talk about what the legislature did and what you need to do in the near future. So I'm going to turn this over to Tammy to introduce herself and our guest. Thank you.
Thank you, Jan. Hi, this is Tammy Hetrick. I'm the Vice President of Washington Food Industry. And I had recently sent some polling out to all of you to really understand where your biggest challenges were around PPEs and childcare and those issues. Based on the feedback we received, we realized that protective equipment for your employees are of utmost importance and a real challenge for you. So we've asked Brett. Brett Holt is Private Sector Liaison for Region 10, Office of External Affairs for FEMA. And he's here today to talk a little bit about what they're doing that can help us try to find the PPEs that we need. So Brett, with that, I'm going to turn it over to you. And thank you so much for taking time to help us today.
You bet. Thank you. So thanks for having me on this call. I appreciate it. My name's Brett Holt. I work with FEMA Region 10, Office of External Affairs. Our region covers Alaska, Oregon, Washington, and Idaho, and we're based right here in Washington out of Bothell, is where we have an office, as well as in Linwood. And so we're doing a lot of different things with the private sector on this particular disaster. And yes, PPE is definitely a concern out there. Originally, as this disaster was unfolding, the major focus was PPE for our healthcare workers, and that has been the focus. And I think as you in Washington and some other states, they've been trying now to see how do we shift that to ensure that PPE is available, of course, for other critical industries such as our food industry. So that, whereas I'm not going to sit there and say there's some simple formula they just switched it. We know the challenge has been where you perhaps have been dropped by distributors. Ones that you normally have worked with are no longer working because they had been focused on with the healthcare workers. So what we right now at a higher level, FEMA and CISA, which is our Critical Infrastructure Cybersecurity Agency, we are developing some guidance that helps out the states look at how they distribute PPE. What are some of those factors where they can start shifting away from our healthcare industry so that they can also help support other critical industries? That hopefully by the end of the week or so, there will be a tool available that will help with some of that allocation. But one of the things I would like to do, though, is I get a lot of inquiries from vendors who have changed their business line. Here in Washington, Outdoor Research, for example, has decided, they're here at the fight to help with PPE, N95 masks, etc. They've come and said, hey, we are here, and how can we help connect with the private sector? I've had a lot, dental supply companies come and say, we've been able to shift, we have PPE available. How do we get connected? And so really what I'm looking at now is, how do I help connect private sector with private sector? Because sometimes getting it through the government is going to be challenging. So where can I help you guys connect with industries that are not traditional industries, especially if you've are no longer working with your normal PPE distributors? So today we actually rolled out a dashboard. We call it the Region 10. And on this dashboard, we'll make sure you get a link to that. It's a real simple dashboard. You can just go in, you just sign in as a guest. There's no like passwords or anything. And you can basically see, there's two sections to it. Who has a need? And you can put it as your company. And if you have a need, type in your name and say, we're looking for N95. Then the other section is who has supplies. And so already in there is out. Here's my name, my number, contact me. And it's a way for private sector to work with private sector. As a federal agency, I'm not endorsing any one vendor over another. We're just providing this platform to hopefully make a simple exchange as you guys might be looking for some PPE for your business. We just recognize that, not just this region, but this is nationally. There isn't a one simple solution. It's everywhere that's having challenges with this, because we know the demand is great. But we think this is one solution that would help you guys connect. And so, with that, I open up for questions on some PPE or where to get this. I'll just tell you right now, the URL is FEMA.connectsolutions.com/PPE exchange. Again, that's FEMA.connectsolutions.com/PPE exchange. And I'll get that URL, of course, in an email out to everybody. So you can. Now, also, I should say the other thing, because what I did with Jan is we had a whole vendor list that people come into us, and they're not necessarily ones that we are going to say that we recommend, but in a sense, I've got a list of people who said they've got PPE, and we have made that out available. Originally, they came to us looking to do work with the government, and we've just said, we've given them appropriate ways they can go and register with the federal government, but a list of 25 companies that have shown interest, we can provide that, of course, to the association, and then you guys can definitely make a call. But it's another way that, it's not your typical 3Ms, but there's others out there that kind of at least give you a starting point when it might be challenging to even find where that starting point's at. So I hope that helps. We're respectful of time, and if there's any questions on this. So how would you like to do this, Kemi or Jen?
Yeah.
Okay.
Yeah. I'll jump. I know I'll jump in. So
okay.
I know Tammy was going to remind everybody that we do have our relationship with the distilleries to do hand sanitizer, and we added a new distillery today that has quite a nice quantity and selling at a reasonable price, and we've updated that on our new today website, and it will go under sanitation. So one of our members, Andrea Mobley of AG Market, she asked a question about PPE access, and I think that you have provided us a major step forward today on how to connect our retailers to the vendors that have various products. Brett, did you see that vendor that sent me that very long list of PPEs today? I sent over to you too. maybe you haven't
so
had time.
I saw your email. I haven't looked at it in detail yet, but
Okay.
but another opportunity for sure.
It'll be a good one to add to your resource list there. But like FEMA, WFIA, we are not endorsing any one company, and we don't have the ability to search these firms. But I think you can tell by their approach to you and their prices if they're legitimate sources. Jamie Deering with Blanton IGA asked a question: is there any such requirement at the federal or state level to mandate masks? And Brett, I think that we would both agree that there is no mandate, but a strong recommendation from CDC
That's correct.
and of course our state. Yes. So we
I haven't
hope
seen
there won't
anything
be
either from FEMA or CISA. I have, or FDA or FTC, CDC, FDA. I haven't seen the mandate, but yeah, strong recommendations. And a lot of that is pushed mostly at a state level or even a local health authority level. But at the moment, not from the federal, I haven't seen.
And so far to date, our labor and industries and Department of Health are making strong recommendations, but not mandates, and very sensitive to our inability to access a lot of these resources. And finally, I'm going to ask, respond to a question of Don Stoles Northwest. If you as an employer can require your employees to mask up. And certainly if you believe that is a workplace safety issue for your fellow employees or customers, you certainly can. That's up to you, the way you operate your business. So I wonder if we could, Rebecca, open the lines, reminding everybody to please mute your phone, but open the lines. So if we have other questions from our membership for FEMA, they can ask those. It will take Rebecca a minute to unmute everybody here.
Yep.
So
and I'm starting
with this, Brett.
I'm starting from the top of the list, so you'll be, if your name.
Okay. So what we're going to do is, here's your member number.
People are not muting themselves, so I'm already having some trouble with that. So please, please remember to mute yourself on your end. And I'm going down the list.
It's always a challenge to unmute these calls. We experience that, don't we, Brett, with the FEMA calls?
That's true.
So do we have any questions coming from anybody?
I've only gotten to the J's. So if your first name starts after J, you're still muted.
And
Jan,
while
Jan,
we're waiting,
Jan, this is Don Stoltz. I'd like to ask a further question about the masks.
Please do.
So the recommendations I still see out there are that we should not be using the N95 masks, and we should just be using cloth masks of some sort for our employees. Is that still what is being recommended?
Brett, you want to talk about the medical industry
shortage? Yeah, so that is the recommendation. Well, that's a lot of echo.
I think I solved
But
that.
the recommendation is, okay, got it, is N95s for the healthcare industry, and the more non-surgical kind of cloth mask that would be more appropriate. Unless somehow your industry requires, there could be, I mean, I don't want to say what it is, but maybe if you're required, I mean, it specifically says you must have the N95 for your workers. If it doesn't, then we really are still suggesting N95s for our healthcare workers, and the cloth non-surgical type of masks for other industries, critical industries.
Are there any other questions? You can remember to use your chat box or raise your hand, and we can get right to you. I don't see anything in the chat box.
So everyone is now unmuted, but if you've got background noise, I'm muting you. So if you try to talk and weren't able to, it's because I had to mute you from my end.
I have a question.
Are there any? Go ahead.
Okay, I was wondering about vinyl gloves. Those are something that we're having a hard time locating. Probably not quite as easy for outdoor research to make them. Are there any new resources available for those?
From where I sit, I'll be honest, I'm not sure on that one. Again, I have a whole list of different vendors that are more than welcome to explore a little bit and see if they have some, or even going in and posting that need on that dashboard to see if there are others. You're right, because like you said, OR is not one that comes to mind that they were doing gloves. But I would encourage you that where you are looking for a vendor, please post that on the dashboard. And then, like I said, I can, the list that Jan has, providing that to you, and see if some of them might do it. I'm not, from where I sit, I know of some names of folks that have come, but I don't know them in detail of every little thing that they provide. But I can at least give some guidance if it says PPE versus they're doing a technology solution. So at least can help filter some of that down for you.
All right, thank you.
And this is Tammy. I would add that we will have that link on our website for you on our COVID site, so you can find that to FEMA.
I had a question, Brent. This is Mike Octave with Employee Resources Northwest. My question to you is on the PPE exchange for employers, since the healthcare community has kind of higher tier access to the PPE, if somebody made a request on the exchange and then somebody had it, do you guys manage who gets access to it prior to, or how do you guys manage it?
No, we're not really. What we're doing is just if you go in and you can see I see it on the WebEx, but if you're to go in, we're not managing that exchange at all. We just want you to be able to connect with people. So we're out of the loop other than giving you a place to connect. And so you don't have to worry about that. So for example, I talked to a group out of Eastern Washington today. This company used to, they do the indoor trampolines and they're all closed, but they've been able to shift with their suppliers and appropriate technology. They've been able to shift to masks, and I said, go register. Let people know that you've got access to creating masks, and then they'll be posting that up there, and it'll be up for you to, you'll see their contact info, and you can reach out to them and say, hey, are you able to help work with us? We need 5,000 of this or 1 million of this, and so you don't have to worry about us being in the way there.
Thank you.
Yeah.
We do have a question in the question box, actually. It says, if we mandate wearing masks, I am assuming we have to provide them.
And from an employer's perspective and PPE, if you mandate some form of protective equipment, yes, as an employer, you need to provide that. Do we have anybody else that has a question before we let Brett go? Okay, Brett, thank you very, very much. And I appreciate the regular conference calls we have with FEMA and the grocery industry. They're very helpful. So thank you so much for being with us today, and we look forward to that dashboard.
You bet. All right. Thanks, everyone. Stay safe out there. All right. Bye-bye.
Bye. So before we mute everybody again, are there any further questions that you have that you may not have wanted to ask with FEMA on the phone? No? Okay. Well, let's move on. But if you think of something, you can always use that chat box as we're going through the rest of the call. We'll move on to the next subject matter is the most recent proclamation by the governor that was issued last night, Proclamation 20-46, that I guess we need to mute everybody again, Rebecca.
I am. I'm going back down the list because if I hit mute all, I'm going to also mute you. So it's...
Oh. Okay. Anyway, it is a proclamation, and I'm not really sure how much difference it makes, quite frankly, but I'm sure that the governor felt like it did. But it is clarifying several things to employers about their high-risk employees. As I reviewed it, I don't see that it is really any different because you are already required to continue the health care coverage when they go on sick leave or paid family leave under the federal government and also under our state plan. And so those are weeks and weeks and weeks. And you are allowed to take the deductible part from the employee's portion of their pay. But if they run out of benefits, then the employer is required to cover the full cost of the health care. But again, that is weeks and weeks out, and we better not be in this situation then. But it is posted on our website under New Today, and we did have a question from Avis Christensen from Brewster's Marketplace, asking that very question, and there the governor, he answered it for us right about the time you sent your email, Avis. So if you have a high-risk employee and they feel like they need to self-quarantine, then they need to go on the paid leave and you need to continue their health care. Any questions, comments? Again, raise your hand on your web page or type your question in as we proceed. The next one is dealing with SNAP, and I have mentioned SNAP a couple times as we've been doing these calls, but I wanted to give you another update because there are large numbers of new people going on to SNAP, and so the federal government, USDA, FNS, is urging retailers that if you are not currently SNAP approved, they want you to apply and get your approval to serve these SNAP recipients. And it's important that you do that also because our state is writing up a waiver request right now, which will surely be granted because the federal government's encouraging this, that the summer meals for low-income children that get their breakfast and lunch meals at school, that those meals be offered on a SNAP card, a SNAP EBT, so that a family, instead of having their children walk to the school or having contact and that type of thing, that they will have a SNAP card that's equivalent to the value of those meals, and mom and dad can do grocery shopping and provide the extra food at home. So you can see that SNAP is not going to shrink anytime in the near future. Up on our new today, we did put the notification up there urging you to apply and what you need to do to be part of a SNAP approved retailer. The second portion of SNAP is 5 states went online, and I've mentioned this before, and I actually put it in our newsletter because I was infuriated by it, that only 2 retailers were authorized in our state as a pilot state to do online SNAP, and that was Amazon and Walmart. But now with the crisis going on and many people that are high risk are on SNAP receiving federal and state support, they are trying to get more retailers to become a online approved retailer. It's not easy. It is not easy. And I just had a call today saying, isn't there some way to streamline this? But it is, you have to be able with your POS equipment, you have to be able to interface with the feds, with the FIS. But the good news is we're already on with FIS. But there are a lot of steps to take to become approved online SNAP retailer. But as we have seen through COVID, the online purchasing is not going to go away. It's going to force the independent grocer into having online purchasing and delivery if you didn't already have it. That document is also up on the new today, and you can read through it. But what I'm asking is that anybody that is interested in learning about this online SNAP retailer and the hoops you have to go through, Molly Popenoff from the National Grocers Association is on the phone almost daily with USDA FNS on this, and she has agreed to do a webinar for our interested members to try to help you through this and give you any ideas for shortcuts. And for those of you that are NGA members, they're actually going to be doing a webinar tomorrow on this topic. But for those of you who are not, just email me. We've got on the document on the website, email Rebecca at wafoodin.org. Her email's right there on the document, and tell her you would like to participate in the webinar to get more information, and we'll put that together so you can ask your questions. But review that document. Are there any questions about SNAP?
There's no questions in the question box, and I don't see any hands raised. Do you want me to unmute everyone again?
Nope. We'll just count on the fact that they will either text me, because I think everybody's got my cell phone, or raise their hand or write a question in there. But I would say too that in order to be a WIC retailer, you first have to be approved for SNAP, and WIC is no longer a paper voucher program. It now has its own EBT card as of January. So as we're seeing more and more recipients of WIC also, and so there is a pathway here for you to be of greater service to your community and for you to keep your customers so you don't lose them to Amazon or Walmart. Next subject matter. Oh, question. Jamie Deering from Blanton's IGA asked a really excellent question. She asked, what is the most current information about the U.S. meat production chicken, beef, pork? And are we anticipating a shortage? And if so, when and how much? Well, that's really a big, big question, Jamie. But I did have discussions today with the North American Meat Institute and with the Food Marketing Institute. And it is true that there have been a number of plants that have closed down. And the response, as a follow-up to my phone call with the National Meat Institute, he wrote a whole paragraph, but this part says, we have plenty of meat in the system, but that will change if there's not a consistent message from the feds to states to local officials that the presumption should be that plants need to remain open. So there's obviously, and as we've seen right here in our state, kind of a tug of war between the local governments, health departments, the state health departments, federal USDA, and they, when you read that, kind of pointing their finger at the bureaucracy and not having a consistent application of inspections and PPEs for their plants. But in my discussion with FMI, they said that at this point, just with one plant that closed down, it will impact the supply chain by 3%. And I'm aware of 2 other plants that have closed down as I did research today. So that's the best answer I could get, Jamie, but that was an excellent question. And we're hoping that the meat industry will get some relief from USDA and inspections will become consistent. As we have been experiencing inspections of our grocery stores from the county to the state are not always consistent, and the rules are not always consistent. And I did file a complaint with our Department of Health this week that we need one standard to follow regardless of where our stores are located. So I'm sure the meat industry is going through the same thing. Now I want to turn it over to Tammy to talk a little bit about the clarity of the SBA loans, and we had questions from our members on that. Tammy, can you jump in here?
Sure. Thank you, Jan. So in follow-up to our call last week on the SBA loans, we've had a few questions come in, and there's been some confusion around the different sections of the PPP loans, the Payroll Paycheck Protection Program. And one of them is because a NAICS code is listed on there, we do have quite a few stores that fit within that. But first and foremost, if you have less than 500 employees, you are eligible for the small business loan. But if you have more than one store and over 500 employees, then you have to have 500 or less at each store if you're in NAICS code 72. So in following up with that, we had a call with our congressional delegation this morning, and we actually said we would like to see that expanded. Our stores are working hard to keep employees working. We've had a lot of increased costs, and we really need access to these small business loans as well. And so we've asked that they open it up to the NAICS code that covers our grocery, convenience, and suppliers. And we're hoping to get to see that happen. I know that our congressional delegation agreed that, they were going to try to do that, and they're in the negotiations now for this next care package. So hopefully we'll see some increase in that, because that will help a lot of our members who may have more than 500 employees total, but less than 500 at each store. So that's kind of the clarifying matter on that. Are there any additional questions on the small business loans? Rebecca,
Raise your hand or type it in.
There's nothing yet.
Okay. And we can always check at the end again. And then if I could just add, we've also wrote to our state legislators, and we've asked them also to help us out a little bit. And really, we've asked for a moratorium on any rulemaking. And we've also asked them to help us with the personal protective equipment. So we've really pushed for every avenue possible to get that necessary equipment that you need. So we're working on that as well. Jan, is there anything else you wanted me to cover, or does that answer the questions?
No, we are in the midst of finalizing our letter to our delegation, and I want to compliment Congressman Kilmer today, because our congressional delegation was on a call with FEMA, and FEMA gave a shout out to all the work our association is doing, because they keep track of all the states and who's doing what. And Derek texted and said, "What can we do for you? And thank you for all the work your association's doing." And he asked for us to submit any ideas that we have that they could help us with for the fourth package. And Tammy and Kat are working on constructing a letter, but if you have other ideas that we haven't thought of or hasn't come up with, we are on calls daily with our national association, so we're doing a coordinated effort. But if send us your ideas, because we can give them all the ideas we have, and just make sure our real high priority ones to help our industry with these SBA loans. Our convenience stores that rely on fuel sales are really hurting right now. It's tough out there because none of us are driving, and most of them own more than one store. And so there are a lot of things that we can do to help you. And we want to make sure we get those both in the congressional letter, but also to our state legislators. And, there's some talk about a special session. I don't know if that will happen or not, but let's get our ideas out there. And the pharmacy board's doing great things to make it easier for our pharmacies. And Carolyn Logue, our contract lobbyist, has been on those calls regular, just doing a fabulous job.
So we do have a question in the question box. What is the status of designating grocery workers as first responders?
Go ahead, Tammy.
Oh, there I
Tammy.
am. Okay. I was having trouble with my mute button there. So yeah, this has been a concern. The concern with identifying them as first responders is then we have an entire worker comp system that gets overwhelmed, because every COVID claim becomes allowable, whether there's evidence that it occurred on the job or not. We're worried about liability and several issues that tie to that. Jan and I actually have a call with Labor and Industries tomorrow, because we want to make sure that COVID claims, although they've provided us with emergency rulemaking that says this will not impact employers' rates or the retro programs and those things, we want to make sure they're using that rainy day fund. That's what it was developed for. And that way we're not going to have a deficiency later down the road and see an increase in premiums because we're all paying for these claims in our premiums. So we still have some work to do, but at this point we have been able to push back on that in our state. So that would be my answer. And Jan, if you want to expand on that, please do.
No, I think, and it's a nuance that as an employer you wouldn't think about. You would think, oh, if we're designated first responder, we get faster access to the PPE. But the fact is, the medical community is number one in line, but we're number two. The governor has made us the next priority under the medical industry. And so if we were to cross over that line, there's a lot of implications on liability on you and on our workers' comp system. And so we're trying to address the issue by finding the resources, and because the governor has designated us just under the medical industry, they are helping us. FEMA's helping us. Department of Health is helping us. So everybody's trying to help you all with your PPE. Is there any concern or further question about why we are not seeking a first responder status? No?
So Kevin also has a comment that he wants to make. So Kevin, you should be able to unmute
Good.
yourself.
Okay, this is it with regard to meat shortages. I think it would be wise to expect some, only in that I'm pretty sure that the producers are going to have to put in place social distancing requirements that reduce their capability to process at a full level. I think it'll be kind of like a toilet paper situation for us. We'll be in line, chains and large groups will be in front of us, and the likelihood of some shortages or reduced supply is pretty high. Having been in those plants and seeing how many people work there, the size of those lunchrooms, they're going to have a different way to operate to be able to stay open, and that way is going to almost for certain result in their less capability to produce at a high level. So
that's excellent input.
You might want to load a little bit into your freezer to have on hand to bridge some shortages of fresh stuff that comes up.
Excellent, Kevin. Thank you very much. That's Kevin Weatherall with the market. So that's an excellent thought.
We have another question in the question box. It says, do you know if the stay-at-home order will be lifted on May 4th, or will it be extended? What are you hearing in Olympia? When will we know?
We are not hearing anything in Olympia, and if you noticed all the media yesterday, our governor has formed a coalition with Oregon and California to do a coordinated reopening, as the Northeast states have done, and they have just started meeting. I'm not quite sure how they do a coordinated opening with California, but you know, I guess they're talking about it. So we do not know at this point in time, and have not heard an inkling out of the governor's office or from Emergency Management Division of FEMA. We have not heard a word. But again, you all see, and I get the daily in-depth reports from FEMA and the Department of Health. You all see those numbers on the news that we have flattened, and the numbers yesterday was finally a little down curve on it. So, you know, our hope is May 4th, but we do not know. We don't have an inkling about it yet. I believe, though, it just from some discussions that were we had on the telephone with the Department of Commerce and Employment Security over at the AWB office that they're going to be looking probably at stages and be doing home building operations potentially first. We were able to get construction on our grocery stores reopened right away. So I imagine they're going to look toward that for two reasons. One, it's a huge revenue source for the state, but two, we need those lumber companies to start cutting wood so we can make toilet tissue. Any other questions? If we get any information on that, you will be notified right away. Although sometimes the governor's office tells us things that we can't tell anybody about, and then they change their mind anyway, so.
Sorry.
Go ahead.
I was just going to say there are no more questions in the question box, so.
Okay. So again, I'm going to.
This is Kevin.
Go ahead.
I would, I don't know about reopening, but we tested 0.006% of the population. They don't test unless you're really going into a hospital type situation. It's such a low level that there's still people that have it, that spread it, that aren't that aware of it until they get testing resolved. They're not going to open it wide. And I'm not counting on it opening up until later in May or June, just because of that fact. We'll be right back to where we are unless they can resolve that issue. And that's kind of the national point of view. It's not the president's point of view, but it is just about every governor's point of view.
Thanks, Kevin. Anybody else? Okay, before I turn it over to Kat, we're going to shift to another topic in the legislation and the state laws. I remind you to please submit ideas to us for the congressional fourth package, as well as sending Rebecca an email if you want to be part of the informational gathering webinar on becoming an online SNAP provider. And of course, at any point in time, please submit your questions to me and I'll sort it out to the staff that's best to answer it. So I want to introduce to you all Kat Holm, our legal counsel and legislative director, to give you a little update on information. Go ahead, Kat.
Good afternoon, everyone. This will be short and quick, like mine usually are. I know that it's hard to remember with everything that's going on with COVID-19, but we did actually have a legislative session this year already, and it ended on March 13th. Carolyn Logue, our contract lobbyist, and I kind of worked very hard. And so we have a legislative report and new laws that all of the staff, so me, Rebecca, Carolyn, Tanny, and Jan and Melissa all worked on. And it should be sent out to you all sometime next week. So this year we'll be doing it a little differently. You'll just get it'll be an electronic copy. And this is important because many of the bills that were passed that will be impacting you all will take effect June 11th, 2020. So that is in about 2 months. So it is important that when you get it to please look at it. Specifically, if you just want to do a quick read through, look at the new laws because that will show you what passed that is pertinent to your business. Please let me know if you have any questions, and I believe we will be doing a webinar, but I need to double check with Jan on that. And just know that we're here for you during this time, and just let us know if we can help. Thanks.
This is the first time that we've done electronic report, and the nifty thing about doing this is Kat has the bills hot linked to the state website, so she does a short summary for you and the effective date, so you know what you have to look at now. But if you want to get in the weeds on it and know all the requirements, you can click on it right there. When you receive the publication, it'll take you directly to the state webpage where you can read the full content of the new law. And so Carolyn and Kat are going to be around to help you get all this implemented. And we're sorry that you have to deal with this now, but it is what it is, unless the governor says all new laws are frozen right now, but I don't see that happening. But I thank Kat and Carol. I know Carolyn's on the phone for the great legislative session, and Rebecca doing all of the bill tracking and reporting. And we got some really good bills passed this year with your help. So I have nothing else. Does anybody on our staff have anything else to jump in with that we missed? Do any of our members have any last minute comments or questions? Okay, well, that's a wrap, and I hope your week this week is great for you, and please use this as you need. Thank you very much.